G'day folks, Dr. Claire Hudson here. Before you scroll past this, let me ask you something straight up. How much has it cost you? Not just in dollars, but in your confidence and your spirit. When your body stopped responding the way it used to. I've been a urologist for over 25 years, and I've seen too many blokes waste thousands on expensive pills, trendy remedies, and miracle treatments that promise results in minutes, only to end up right back where they started. Frustrated, embarrassed, and still searching for answers. Here's the thing, guys. Most treatments fail because they're only treating the symptom, not the root cause. They're giving you a temporary fix, like putting a Band-Aid on a leaking pipe. The erection comes and goes, but the underlying problem remains untouched. And that's exactly why I'm recording this today, because I reckon it's time someone told you the truth about what's really going on down there and how to fix it properly. Now, you might be wondering, what makes me different from all those other doctors and online experts? Well, I don't sell you expensive supplements or fancy treatment programs. What I'm about to share with you is backed by solid science, costs less than your morning coffee, and addresses the real issue at its core. Sound too good to be true? Stick with me for the next few minutes, and I'll show you exactly how this works. The key to understanding erectile function isn't complicated, but most blokes have never heard it explained properly. Everything starts with something called the endothelium. Think of it as the inner lining of your blood vessels, like the smooth surface inside a garden hose. When this lining is healthy, it produces a substance called nitric oxide, which is absolutely crucial for getting and maintaining an erection. Nitric oxide relaxes the smooth muscles in your penis, allowing blood to rush in and create that firmness you're after. But here's where things go wrong. When your endothelium gets damaged by high cholesterol, high blood pressure, smoking, diabetes, or simply a deficiency in certain nutrients, its ability to produce nitric oxide drops dramatically. Without enough nitric oxide, the blood vessels can't dilate properly, and you end up with weak or inconsistent erections. It's not about your age, your testosterone, or your willpower. It's about the health of these tiny blood vessels. So what damages the endothelium? Inflammation, oxidative stress, and a lack of essential nutrients. And this is where most treatments completely miss the mark. They try to bypass the problem with drugs that force blood flow, but they never fix the underlying damage. That's why the effects don't last, and why you need to keep taking them. Now, let me introduce you to something that actually repairs the endothelium and gets to the root of the problem: folic acid, also called vitamin B9. I know what you're thinking. Folic acid, isn't that for pregnant women? Well, yeah, it's essential for pregnancy, but it's also one of the most underrated vitamins for men's sexual health. Folic acid works by reducing homocysteine levels in your blood. High homocysteine damages your blood vessels and interferes with nitric oxide production. By bringing those levels down, folic acid helps restore your endothelium's ability to do its job properly. The brilliant part? Folic acid is dirt cheap. You can get a month's supply for less than a couple of bucks at any chemist. Compare that to those little blue pills that cost you $50 a pop, and you start to see why pharmaceutical companies aren't exactly shouting about this from the rooftops. Here's what you need to know to get started. The recommended dose is between 400 to 800 micrograms per day. If you're over 80, don't worry. It's perfectly safe for you too. Take it in the morning with breakfast, as it absorbs better with food. You can get folic acid from leafy greens like spinach, legumes like lentils and chickpeas, citrus fruits like oranges, and fortified cereals, or just grab a simple folic acid supplement from your local pharmacy. But here's the catch, and I need you to hear this clearly. This isn't a magic pill. You won't pop one tablet and suddenly have the erection of a 20-year-old. Folic acid works by repairing your blood vessels over time, which means you need to be consistent. Most of my patients start noticing improvements in their energy and morning erections after about 2 to 3 months of daily use. Combined with cutting back on alcohol, quitting the smokes, eating better, and staying active, the results can be life-changing. I've seen blokes in my clinic who've spent years and thousands of dollars chasing solutions, only to find that this simple, affordable vitamin was the missing piece all along. One patient of mine, a 7-8-year-old retired tradesman, came to me completely defeated. After 3 months on folic acid plus some lifestyle tweaks, he told me he felt like himself again, not just in the bedroom, but in his overall vitality and confidence. So here's my challenge to you. Give it a proper go for 3 months. Track your progress, stay consistent, and see what happens. If you've got questions about dosage, interactions with other medications, or anything else, drop them in the comments below and I'll answer them personally. And if this video helped you, hit that like button and share it with any mates who might need to hear this. Cheers, and here's to your health.